Good morning, everybody. This is the Board of Health meeting at the Norwood Senior Center for October 23rd, 2023. First item on the agenda is approval of the minutes for September 12th, 2023.
Make a motion to accept the minutes.
I second the motion. All in favor?
Aye.
Aye.
Can you
Okay.
second the, can you second it?
Yes.
Okay,
Okay. As long as we're in agreement.
okay.
We have no new business this morning?
No, you're not voting on anything today.
Oh, okay, good. So we're moving right along to old business. Impact Norwood Program Director Report. Yeah, have a seat.
Hello,
Good
morning.
how are you?
Uh-huh.
So it's been a while since I've been here. I think Bob Blood came in.
Yeah, once.
Yeah.
Yep.
So Bob is our new program coordinator.
What are you?
I'm the program director.
I wanted the town to know that.
I'm the
I know what
yeah,
you are.
I'm the full-time director, and Bob is the part-time program coordinator.
Okay.
So the past 5 months or so, this is what we've been working on. We're officially in year 7 of the grant right now. So we have 4 years left in the grant. It'll end in September of 27. Our next progress report is due in August. Our one from 2023 was just accepted by the CDC. They said looks good. We have also rolled over about $20,000 from last year to this current grant year, which is great. So we have a little bit of wiggle room this year to work with some of the projects we're working on. Our coalition, which is the larger group that's open to the public, anyone can come to those meetings. That we meet monthly right now, which is kind of new. We had one recently at the library, which went very well. We had about 25 people show up, which is one of our bigger crowds.
Okay.
A lot of good ideas thrown around, so we're excited about that. The steering committee is still meeting monthly as well. We actually have a meeting tomorrow. Currently, we have 7 people on our steering committee. Amanda Grow, the select person, was actually just added to our steering committee recently. She'll be attending going forward, which is great.
What is a steering committee?
Our steering committee is a group of people who help basically just steer the grant. They're kind of the decision makers, they're the brainstormers, they're the ones kind of coming up with the ideas that we implement moving forward.
And do you head that?
Yes.
Are you?
Yep.
Okay.
So
Well, I would hope you have the final decision in that.
technically the steering committee does, but they work with me.
Okay. Can you just tell me when your next coalition meeting is, so people who might want to go?
Yes, it's November 30th.
Is it always on a
At
Thursday?
7 p.m. in the Simone room at the library.
Simone Room at the library.
Yep.
Okay, great.
So as part of the grant, we have a youth ambassador coalition that Bob actually leads. That group has actually been growing pretty quickly this year.
Okay.
It was a little stagnant for a while. We have over 10 students that show up every week. They meet on Zoom on Wednesday nights, and then they also do some weekend stuff here and there. They've worked on a mental health is health campaign that was in all the schools, was in the town hall, was in the library. They're currently developing a wellness magazine. They're looking for stories of inspiration from town. It could be like an essay, it could be a painting, a photograph. And they're going to create this and basically hand it out to the middle school and high school students as just a means to inspire wellness and healthy living.
How do they hand this out? Is it at random high school students? Do they make them come and take one? I mean, this is the problem. Not everybody
Yeah.
gets to have
So
this. It's-
they're working closely with the guidance department and the teachers at the school to make sure that's out. They're in the very beginning stages of this.
So they're not in a pile and kids walk by them. That's
We'll probably have a pile too, but we're also going to be actually handing them out. Some English teachers said they might actually be able to help out a little bit in terms of collecting essays and ensuring that people are actually reading them. And
See, I think they
We're in
should
the
be held
beginning
out at a assembly and make mandatory. I think all of this stuff should be made mandatory
Yeah.
at some point. You know, if the football team has a meeting, hand them out.
Yep.
If the hockey team has a meeting, golf team has a tournament play, hand them out.
Yeah.
I mean because they're overlooked. I feel more than read by so many of the students.
That's a good point. That's something actually we've talked about is working closer with the athletic department.
Absolutely.
Because you can't mandate everything, but the coaches can mandate certain things.
But kids,
They have certain
they want to do
expectations.
that thing. They want to do that
Yeah.
sport. They want to listen to the coach.
Yep, absolutely.
Now, what about if somebody has some wellness ideas? How would they get a hold of the students, or do they contact you?
In terms
or-
of the wellness magazine?
Yeah.
So they haven't started actually putting this out yet, but they have a
Okay.
big marketing campaign that's going to go out to the schools so anyone can submit something to this.
Oh,
That's
good.
the whole idea. And this has been totally student run. We're kind of taking a step back and we're helping them facilitate it, obviously, and
Okay.
making sure they kind of stay within the realm. But they're going to open it up to anyone that lives in Norwood, works in Norwood. It could be, someone from elementary school, or it could be someone at the senior center that wants to write a piece. And I think the whole idea is just kind of show that everyone's got their struggles, everyone has their things they go through,
Yeah.
and there is another side to it.
Yeah, again, keeping this a secret is not helping anybody.
Yeah,
Yeah.
exactly.
Can I ask another question, or you want to finish?
You can, whatever you like.
Okay, this wellness magazine, will this include what you're trying to tell the community about marijuana and alcohol?
So-
Or I'm very concerned about how you're going to get that out.
Yes, so I mean, it's all connected, obviously. There will be stories. There are going to actively try to get stories about like substance use prevention or addiction or whatever it might be. We're also looking for stories just about wellness and mental health, because our data shows that there's like a direct correlation between mental health concerns and substance use. So it's all interconnected. I think part of it is ensuring that every kid is in a place where they don't even want to look to drugs and alcohol, because they're already feeling good about themselves, they're feeling connected to their community.
Yeah.
So it'll be a little bit of everything.
Yeah, those kids, but there are other kids
Yep.
that need that support.
Yeah.
Do we have a referrals out of this to Riverside?
We'll have the number if anyone has mental health
Yeah.
issues. They can call that interface phone number. The parents can, and it hooks them up, looks at their insurance and exactly what their needs are, and helps them find an appropriate provider. So we have that.
So why is vaping gone out of this? It used to be alcohol, marijuana, and vaping. Vaping seems
Yeah.
to be not part of this at all.
So the way the grant works, the first 5 years you have to pick 3 substances to focus on. And at the time, I wasn't here, they chose alcohol, marijuana, and vaping, which technically is nicotine.
Right.
And then the second 5 years, you have to get rid of one of those.
Oh.
I also wasn't here for that. And they chose marijuana and alcohol, which is pretty common. That's what most people that get the 10 years of the grant do.
Okay.
Because vaping obviously is a concern. It's not. We're not going to ignore vaping. We're still working on it. It's just the goals of the grant are geared towards alcohol and marijuana.
Okay.
So the other thing along those lines that the student group is kind of working on right now, again in the beginning phases, is developing a mentor program between high school students and middle school and elementary school students.
I like that.
We're in the very, very beginning phases of that. They're working with the school wellness committee, a little bit, health council, on that.
Okay.
And that will be just another way to, put some kids who are good role models and provide them access to younger students who they can work with, who they can kind of model, the right behavior with,
Yeah.
get involved, build relationships.
Which actually will help them when they get to the high school level.
Exactly, and
Well,
it's,
they need help in the junior high too.
I think
Yeah.
anyone who's been to Father Max or any of the parks in the summer and sees the camps going on, you see how the 4th, 5th graders just love the older kids. So we're trying to
Always.
capitalize on that as much as we can.
And who picks those students? You, the steering committee?
That'll probably be the schools.
Guidance.
We're gonna work with the schools on that, yeah.
Yeah.
So other things we're working on briefly, I don't want to talk too long.
Okay.
Bob and I have been attending every PTO meeting recently. So we have one tomorrow night with the Coakley. And basically just kind of introducing ourselves, letting them know the work we do, encouraging parents to really kind of have like open communication with their students. In the past, the elementary schools have kind of been, I wouldn't say ignored, but weren't part of the conversation. We're starting to realize the earlier you kind of have these conversations with parents and kids, the better. So we're trying to really make outreach to elementary schools as well. Mass Call 3, which is the group that we're in with Stoughton, Easton, and Avon. It's a regional grant. We're currently making a podcast. I don't know if I have the voice for radio, but I'm on it. And then we're also developing some parental workshops and events that are regional but can be specialized to Norwood for our case. So we're working on that as well.
Okay.
Impact Norwood is funding and helping to facilitate the Metro West Adolescent Health Survey, which is coming up early November. So that's for grades 6 through 12. They do it every 2 years. So all the data we have right now is from 2021, which was kind of like the end of the pandemic.
Yeah.
So I think a lot of coalitions are expecting that maybe the numbers might look a little different. The data might look a little different this time around. So it'll be good to have new data to see exactly what's going on. We're continuing to meet, collaborate with town departments, organizations, and businesses to provide age-appropriate activities for the adolescent group, mostly the 6 through 12 graders. I think we've talked about in the past, Norwood does such a great job of providing things for younger students and the seniors.
Yeah.
And I think really kind of looks to the schools to provide that gap for grades 6 through 12. So we want to make sure they have more options outside of the schools. We've been attending town and school events to promote our work and hand out information and educational information. We've done one of these, the Senior Center Conversation Series. We're going to do more of those going forward. We actually did it in this room right here. We had about 3 students with us, and I think about 15 seniors showed up, and it was great. They had like a really open, honest conversation. I think, the seniors really were able to give them some good advice. I think the students were able to explain some of the obstacles and challenges that kids are facing nowadays. And it was just like another way to build a relationship
No,
with the
that's,
community.
to me, that's remarkable and that's
Yeah.
helpful.
Bob is going to be spending more time in the Coakley and the high school, mostly the Coakley going forward. We're still trying to find him the right time and space for that to happen, but he's getting there more often, and that's going to be a real goal going forward, to have him there 1 day a week just working with the kids. And then outside of all that, the steering committee and myself and Bob have kind of decided to really put the focus on parental support and providing positive activities for kids. That's really kind of our 2 main focuses right now. We're going to continue to do the education piece, continue to do everything else we're doing. But I think the more data we collect, the more we look at the data, it just becomes, it's becoming obvious that I think a lot of parents just need some support. There's a lot going on nowadays, and
Yeah.
the more we can provide education to parents and just non-judgmental support to parents, I think the better off them and their students will be.
Very nice.
And that's all I got.
Excellent.
I had,
Very good.
excuse me, I had talked to Bob, when you were out, about a video that came out that, it's probably now a year old, it's called Take a Tote.
Yep, I've heard of that.
Yeah, it was a lady from Situate. I just came upon it and I thought, whoa, this would be great. And I spoke to Bob about it. I don't know where it went with that.
Okay.
I wondered if high school may be a little bit late, but I wondered if the junior high would be the place to start with this video. If you could review it with
Yeah.
Bob again, and maybe a guidance counselor to see if it's acceptable for the high school or for the junior high. I would love for the kids to see it.
Okay.
It just, have you seen it?
I have not seen it, I've heard of it.
It just tells you where it goes wrong with
Yeah.
vaping and how it starts and what you think and what this does.
Okay.
Just to visualize it,
Yeah.
just to visualize it.
Absolutely.
And it's from a mother and her son working very closely to get him to stop vaping, but it's really kind of a heartfelt, remarkable little story.
Okay. Yeah, I'll definitely check that out.
Yeah, thank you.
There is another documentary we've been looking at that if we can find.
See, I didn't know that this was a podcast or a documentary.
I think Take a Toke's a documentary.
Okay.
So there's one called Screenagers, which is about students and obviously the detriments of staring at a screen all day and social media, and they actually talk a lot about substance use. Screenagers.
Ages.
Yeah, so instead
No,
of teenagers,
fine.
Screenagers.
Yeah.
That's one that we've been looking at. And,
But thanks COVID for that one.
Yeah.
But I'd like you to take a look at Take
Yeah,
a Toke.
absolutely.
And I hope that's the name of it.
I think that is the name. I've heard of
Okay,
that.
thank you. I think everybody should say, take a look at it. Thank you for your
Is
help.
it something that people can access themselves?
Yes, yes it is.
Yeah.
Maybe we could put it up when you find it
Yeah.
and research and you look at it, see if it's appropriate.
Yeah, I'll have to look into licensing and things. All
Sure.
the documentaries are a little different in terms of that. But
It really is very good. It's local, she's from Situate.
Yeah, that's
I'm
even
so
better.
sure,
Yeah.
Okay.
That's all I got.
Great
No,
work.
no, that's great. I'm glad to
You've
have you
been
back.
very busy.
Yeah.
Thank you.
We're going forward with this grant. And that kind of money is a lot of money. We should be able to do a lot with it.
Yep.
And to get the coaches involved,
That's something we really want to do going forward.
I'd like to see you do that. Thank you so much for
Yep.
your help
Okay.
and expertise.
Thank you.
Okay, moving right along. Public health nurse report. Good morning.
Good morning.
How are you?
Good, how are you?
Good.
Do you have any questions?
No.
I don't. The clinic's still going on?
Clinics are
It's
still going on, yep. We'll be reaching out to the public to see if they're gonna want shots. Towards the end of the month, they can make an appointment with me in my office. They
Okay.
can just call my phone number or write me an email.
Okay.
And then we can just
Are
do
you
a shot
getting a
there.
lot of people
We're still
calling
getting,
for
we're still getting a
appointments?
lot of people that are calling.
Just for
appointments.
flu though,
Just for
correct?
flu, we're not
You're
doing
not
COVID.
COVID, okay.
Just flu.
Yeah. Yeah, because it's pretty tough at the pharmacies to get COVID too, so,
Norwood Pharmacy has them. Just call and make an appointment.
yeah. if they have it. You gotta call the day.
They had
every day.
Pfizer in Moderna when I was there, but, well, let's hope they get, yeah.
Yeah.
You
They-
called?
I called, they didn't have any today, so. You have to call every day, most of them.
I got it.
The Children's School is putting on a catch-up clinic on October 27th at the
Okay.
high school from 2 to 5.
Oh,
So you can call her also. She's at 781-440-5843. And you can sign up with her to do either, even for adults, they're gonna have the shingles vaccine and things like that. So RSV, shingles, COVID, flu,
oh, all of
I
them.
think a couple other things. So it's called a catch-up. So for young children to seniors. So if you haven't gotten any of those yet.
And what's the date of that?
October 27th, this Friday, from 2 to 5 at the Norwood High School in the cafeteria.
But you have to call and
Give
they-
her a call.
Give her a call.
Yeah.
Okay. Okay, that's good, that's good to know. A lot of people, I'm sure, will take advantage of that.
Yep.
Especially with shingles vaccines and stuff like that, because they're all.
Yeah, she has a whole bunch of vaccines that are coming.
Excellent.
Diana, you were great, thank you.
You're
Thank
welcome.
you.
And just so you know, we purchased 500 flu vaccines.
Yeah.
Just so you know the numbers.
Wow.
We're almost done, right?
Yep.
And probably about 100 left.
Oh, wow, we've
Yep.
done, that's huge. Good, great. Okay, I know Angelo's almost ready to. Environmental health inspectors report.
I would like to take a minute to congratulate your son on the golf team
Oh, thank you.
in making the tourney.
Yes, thank you.
Congratulations.
Thank you.
It's very important, he's just a sophomore.
Yeah.
He's a sophomore already. Jeez. Okay, so do you want to start off with the new food establishment
Sure.
report?
Yep. We had one establishment open, which was Simple Sweets. The other there on the bottom of that list, that are still all pending.
Okay.
Let me know if you have any questions on any of the pending. Yes.
Could you tell me about Chipotle? I couldn't find why you had them on the list, and it's a big DoorDash from my family, so
Okay.
I need to know what was wrong with it.
That was a follow-up inspection.
Yeah.
that
You
I-
know,
They had a they
I
had
couldn't
a
find what it-
complaint, I think.
You know, I
if
don't
correctly.
remember
oh, okay.
what the
Wa-
original
Was it a
issues were.
complaint?
I think it might have been a complaint by a customer.
I don't
I'm not
remember
exactly
what.
sure.
I couldn't find it anywhere.
But Kyle did a follow-up and they were compliant with all the items that were noted on that inspection that we can't remember what the issues were.
Okay.
So, yeah.
Thank you, Kyle.
Yes.
Thank you, Adrian.
Is there anybody that you feel out of the list that we need to put on? to
I
be-
reviewed the list again this morning. I don't see anybody
Okay.
that would need a follow-up for next meeting.
Okay,
Just want to let you know that there are 2 pending re-inspections that I'm doing. One is for Royal Pizza, and the other one is for the Truly Indian establishment on Route 1. So I'll be going back there in a couple, I'm sorry, they were inspected, sorry.
they were re-inspected?
Yes, they were
Okay.
inspected, so, and they were compliant with all the items that were noted on
Okay.
the previous inspection, so.
It's not like Shefford and Eaton to have anything, that was, Shefford and Eaton had 2 criticals, but they never have anything,
Yeah, right.
so.
Have
What
they,
page is that?
it's on
3.
page 3. Have they renewed their choke save certificate?
Let's see here. They have 30 days to comply from, so by November 11th. it should be-
November 11th,
Yes.
okay.
So we'll follow up with that.
You'll follow up
Yes,
with that?
yeah.
See, it says Chipotle, follow-up Board of Health, all violations corrected from previous inspection, so,
Right, and that inspection was noted on the previous inspection report from our last meeting.
okay.
Yeah. I wanted to ask you about Saab's Market.
Yes.
What happened with that? I
I believe the
heard that they were
yes.
closed down by the state. Is that
The
true?
sheriff's department was involved,
Okay,
and they're the ones who put that sign up.
okay.
I don't know the details as to why, but that place has been vacant ever since.
Would the sheriff be finances?
I'm not sure. That's a good question.
I don't,
Yeah.
I just know, I heard that
Stace?
it was
With the
closed.
sheriff?
It could be taxes. it
Is
could
the
be
sheriff the
anything. I don't
county,
know.
the
Rent.
county, like Norfolk County?
Norfolk County Sheriff's
Yeah.
Department,
Oh.
yeah.
Yeah.
Do you have anybody else?
So they can't open, they're done, we
Yeah,
pulled their
they're done.
license?
Yes,
Everything's been,
Yeah, they're no longer, they haven't been operating for quite some time.
And you're staying on, the other one, on, my mind's blank, yeah.
The one on Cottage Street.
Yeah,
Sage.
Cedars.
Yeah, Cedars Market.
Yep.
Okay. Hampton Inn,
Yes.
no certified food manager, allergen certificate, or choke safe personnel online.
Yep. Reinspection was done,
Okay,
I believe, 2 weeks later,
yep.
and all the noted violations that you just mentioned were corrected at that time.
Okay, so they do have those people on
Yes.
board now?
Yes.
Okay, good. Good. It makes me nervous when I see that people don't have a choke safe, somebody.
are we having a choke safe class?
Beth does it every summer at Memorial Hall at Town Hall every August.
Oh,
She
instead of
schedules
summer, I
a
remember
class.
Beth doing it,
Yep.
yeah.
Yep. And she also offers classes in 2 towns every month
Mm-hmm.
throughout the year.
Yep.
That Kyle and I have flyers that we hand out to
Okay.
the food operators if they need somebody or people certified.
Tell me about Simple Sweets. There's never a parking space, so I'll never get there, so tell me what it is.
They do boba teas there.
They do what?
Boba teas. They
It's
do
like-
specialty teas.
Kind
Oh,
of
tea.
like
Teas,
pearls
yep.
that are in the tea or something like that.
Pearls?
Yeah, some kind, not real pearls, but like tapioca pearls.
Yes, they're tapioca.
Mm-hmm.
They do ice cream there as well. They do prepackaged foods, chips, chocolates, so,
Yeah.
so, yeah.
I guess it's kind of taken off. A lot-
Oh, I
a lot
heard
of
it's
people have
wonderful,
been
yeah, I
going
wish
into
them
it.
lots of luck, I think it's great.
There was
The
one
name
other-
just, I think it's a bakery, but,
Oh.
you know?
Norwood Spice was the other one that no staff certified. Page
Yeah.
11.
The only staff member that's certified there is the owner, and he was not there that day.
Okay,
So they need additional staff certified for every shift. So when he's not there, somebody else is certified.
Okay.
So they have 30 days to comply with that, and
10/28, at the end
yeah.
of this week.
So I'll follow up with them
Okay.
to find out what the status is.
Okay. And the only other one that I think I have a question about is Norwood Country Club. What's going on there?
Unusual.
Sanitizing not taking place, ware washing procedures,
Mhm.
unclear, the employees were unclear on it. It says training was provided, so I assume that Kyle, you talked to them
I did.
about that type of stuff? Okay.
Yeah.
But they also have no certified food managers choke safe certificates, so,
We can follow up with them and find out what the status is.
yeah, I'd like to just know, I mean,
Yeah, sure.
I like knowing that there's somebody, if somebody should choke for any reason, that somebody
Okay.
knows what they can do to help them, and if they don't have it there. I mean, this is a golf club,
Yep.
so,
So we can put them on an update list for next
Okay.
meeting as the only operator that we'll follow up on.
yeah,
To make
I would
sure.
like
Okay,
that, just to
yeah.
make
All right.
sure.
So could you tell me how you and Kyle are splitting this, or doing what, or how we doing this?
So we have right now about 200 food establishments that we've inspected.
So
we
how many
split
do we
the-
have in the town?
I think it's over 200.
Really?
Yeah, so we've split the list 100 each.
Good.
And we're working with Abby. She split the list between Kyle and I, so we'll have that list for a year or two. And then
Okay.
after a year or two, we're gonna switch our list.
Very good,
Okay.
very, very good, very
That's how
good.
that's gonna work moving forward.
And both of you can open restaurants?
Oh, yes, we.
Both Kyle?
Absolutely.
Okay, that's
Plan
that's great.
reviews, all that, yep.
Okay,
And we decided to partner, as you noticed, at this meeting. So we might partner up for a few more times in the
Oh,
future.
that's great.
But then we'll alternate
Yeah.
coming to the meetings if that's okay. Yeah.
okay. Let's go through our new establishments.
Well, I just have one more.
Oh, go ahead.
Yep.
Is Orange Leaf, another one that has no, the certified food manager's food allergen certificate is expired. They're supposed to do video training. It's 10 days would be the end of this week. Oh,
Yeah.
well, no, actually,
I can follow up with them.
yeah, if you
Make sure
could,
they got
just to make
certified,
sure
yeah.
that they're on top of that.
Sure.
And that's all that I have on the
Okay.
list. That's enough, right?
Yeah. So the only food establishment that'll be on the update list is Nova Country Club for
Yep.
follow-up.
Excellent,
All right.
yep. Yeah, just to make sure. I don't like, we don't inspect them that often. Is that once a year?
It's- Which one, the country?
The country club?
I believe it's twice a year.
Twice a year?
Yes.
Mhm.
Okay. Okay.
My question is furlongs, how they coming? I keep hearing slow, slow, slow.
Yeah,
What's the
there's
tie-up?
some-
Babels, I mean, old Babels or furlongs?
I heard
It's the
of-
furlongs, some equipment's back ordered.
Yeah, that's what I
There's some-
heard.
Yeah, they wanna open in a couple of weeks, so we'll see what happens. I actually did a walkthrough there, last week actually with the owner. They're coming along pretty well, but there's some back ordered equipment they're waiting for. And they have to take some equipment apart at the old location, because it doesn't fit. They have to take it apart and put it back together at the new location, so.
Oh, I hope they're open before the holidays. 'cause it's-
Yes, that's the busiest time, so she's,
Yeah, they're
high
pushing.
anxiety.
And certainly the parking and the location is gonna be in even more volume for them, you know, they're just a great local company that have been around forever.
Yeah, it looks great in there. I did a walkthrough.
Is it?
It's come along really, really well, so they should be ready soon, hopefully.
Good, glad to
So,
hear it.
yeah.
How about Little Tony's?
Little Tony did a walkthrough there as well a couple of weeks ago with the owner. They want to open November 1st
Ooh.
or the 2nd,
Oh.
so I'll be doing a final permitting inspection for them.
There's no
hopefully soon.
seating in there, is there?
There was no seating in there. No, it's just
No.
going to be a takeout.
Okay.
Is it Italian food
Italian. He's going to keep the same,
as what was there?
what was there before. Yeah, same
Okay.
menu, pretty much.
And which one is Mama's Bar and Grill or La Casita? Which one is the Chamois?
Mama's.
Mama's.
Mama's. How's that coming?
Yeah, we haven't. They're still doing work outside. There was scaffolding there the other day. I don't know.
Inside been done at all?
They
People are
did work.
asking.
They did work inside there as well, but they haven't contacted us for inspection or walkthrough.
Yeah.
Oh, so they're not even.
So I don't think.
No,
might not be
they
ready.
put in a whole bunch of windows out
They
front.
did. Okay,
Yeah.
that's probably.
I just drove by there the other day, so
Yeah.
it looks like it's moving along.
Outside, yeah, I
Yeah.
just wondered how the
Yeah.
inside was.
Okay.
And where's Two Brothers Market? Is that a meat market?
That's going to be a Brazilian meat market.
It's the
That's
one in the Rama
down from
Center?
Buffalo's. That's Rama Plaza.
Oh, okay.
Down from Buffalo's.
Yeah.
It's going to be to the left of the hair salon there. in the
Buffalo.
Oh, yeah, okay.
Yep.
And La Casita is in South Norwood, that's,
Yes, that's going to be a burrito taco
Across from the
location
Welch.
across the Welch.
In where
Oh.
Bananas used to be, right?
Yes,
How close is that?
they're mid-November
In November.
is the timeline that he's shooting for. So,
Okay.
yeah.
Lot coming, boys.
Yeah.
So we might have some updates for next meeting.
That'd be
Okay.
great, Angela, thank you. Thank you, Kyle.
Thank you very much.
Awesome.
Thank you very
Excellent.
much.
Thank you.
Now, moving along to the director's update.
So the dental clinic, so I'm gonna give you an update on that. So
Okay.
the Norwood Smiles Dental Clinic that I told you last time, we haven't had a clinic since 2019. It ended with COVID.
COVID, right.
So this is the first year starting this up with the new dentist, Dr. Victor Nayukundi. He's excellent. He's gone into the schools,
Oh.
finished all the screening. Over 1,000 children have been
Wow.
screened.
That's wonderful.
In a
So,
month's
um,
time?
Yeah, he's quick.
Wow.
But it is quick, the screenings, you know,
Yes,
it's
but it's a lot
wonderful
of,
there.
lot of schools, a lot
That's
of,
absolutely fantastic.
yes. So we're very excited
Is there a
about
fee
that.
for that, like $1?
No,
No
we don't
fee?
charge.
Wonderful.
We don't charge. That's just more, it's just not worth it. We don't need the dollar. It just adds
No, I'm
more to
thrilled.
it, and if someone doesn't have it, they forget it. It's
Right,
just-
right.
We don't need it.
We
So,
want to
um,
make it
going-
easy for them.
Yeah, so it's going great. So the parents will get a mailing home with their results, and then they can go to his office for treatments, screening, fluoride, bite wings,
Listen to you,
cleaning,
bite-
saline,
bite
bite
wings.
wings, and fluoride treatment. And then any of the children that have serious dental issues, we can help with that also. And if they have insurance, their insurance is billed first, and then we'll cover the rest.
That's wonderful, Steve.
Until the funding is depleted.
Depleted.
Then we look for other
Wonderful.
Funding.
funding for that.
Okay.
But we're
And there
very
may be
excited
more in
about
town
that.
for that, I think, so there is some.
There is, yes. The Masons.
Yes,
The Masons
exactly
help
what I
the school.
wanted
They're
to
very
say.
generous. Moving right along, COVID test kits. Most people probably know that you can order them from the United States Postal Service at covid.gov/tests. You can get 2 per household, and then we also have some in the office. So if anyone needs any kits, you can stop by the office. We just got a shipment in.
I just got mine, but the same thing with them, they have the expiration
They
dates
have,
on
yes, so if you
some of
look
them.
on it,
They
Most
have
of
been
them.
extended, but,
Right, and they are extended. When they first started doing COVID kits, they didn't know, since it was new technology, how long they would be good for. So
Yeah.
they gave them kind of a short expiration
Expiration.
date. And they are good for quite some time, sometimes a year out, 18 months out.
Really?
So, yeah, yeah. And you
I-
can tell too, there's a control when you do the kit. As long as the control comes up positive,
right.
you're in good shape, so.
Plus, you can use, there's a Q scan
Mhm.
code, and that can tell you how long they're good for, how
Right.
long they extended it for.
Yes, and if anyone needs help with that, they can feel free to call the health department, we can help them with that. Look it up.
What about Narcan? I saw 2 advertisements on Narcan. Should we have that in our home, or should restaurants have that, or should this, I mean, what's the story with, what should we do?
I think both police and fire carry it.
Police and fire carry it on every call.
They have it in their cruisers, and the fire department has it, I'm pretty sure.
Yeah,
Have it on
everybody-
board.
And you can get it to keep in your home.
Yeah,
You can have it, people can have it, even if you don't know if there's an issue, you can carry it.
yeah.
Where do
Because
you get
may
it?
come across. You can get it at the pharmacies, and sometimes, we're actually thinking of maybe ordering some and distributing it. That's for kind of a future project we're working on,
It's a
so
good
we're
project.
hoping to kind of have a CPR first aid project.
Oh, that's
along
wonderful.
with giving out having a Narcan training and giving out some Narcan kits to
So,
families.
so the high school doesn't have it with their with
Oh, I'm
their
sure she does, in
shock
the
kit
nurse's
and
office.
stuff. I mean, is that no, but is it a
No,
requirement?
I don't believe so with the AED. It's not with an AED.
You have to be, it has a short expiration date, so you
Back in?
can't, yeah, so you can't, it's not something.
So it's not a
that-
requirement on a,
No.
in the
No.
nurse, in the school department?
Not that I'm aware of.
Okay.
Does the nurse have it in her
I
office?
don't know. That would be under the schools.
Yeah,
That's a good question though, isn't it?
yeah, I'd be I don't know what she has, but that's a good question. It is a school department issue, but
Yeah.
I do know that both police and fire have it.
Yes.
The police carry it in their emergency bags, and because they're first responders, so they would probably get the call from the SROs at the high school or the junior high school, and they can bring it with them. And usually whenever the SRO calls for a medical for the police come, but they also send the fire department that I know of. They've sent them out all
Could you tell the
time.
town what the SRO is?
Oh, Student Resource Officer,
Thank
sorry.
you. And so, I'm looking forward to this future with the CPR and all of this. Would that be open to the public as well?
It would be for the public.
Public.
It is something that, we were in discussions right now of what to do about this in the future. So that's exactly what we're, in the beginning, the public health nurses just trained, went through the whole course on being a trainer.
Diana?
So she can, Diana did,
Oh, it's
yes.
wonderful.
So, yes, we think CPR is very important, knowing how to use an AED.
Yes.
Doesn't do you any good to go to these boxes and not know how to use an AED. It's
Right.
very easy.
Yeah, it is
But you
very
want to
easy.
keep educating the public so they're not so fearful of it, because it is scary.
Again, the
It's
school
scary.
department has AEDs.
Yes.
Yeah, yeah, they do.
Okay.
Yeah.
I-
All
But
the- all the-
police
all
and
the
fire
schools-
carry
all the
them as
public
well.
buildings do.
But there's so, no, okay, so we're talking about knocking, you talk about all these young kids, these athletes that are having heart attacks on the field at practices, girls, young 16-year-olds, I mean, would an AED certainly help them,
Oh, yeah, athletic directors, they're very aware of all that.
Yeah.
Okay, good.
I
Again,
think
that's
they-
a school, the schools are
Yeah,
on
that's
top of all
involved with the
that.
schools, but I
Okay.
think that they also, I think it might be a requirement for them to bring it with them. I'm not sure, but I'm pretty sure that because of all of the sports issues that have been
Yeah,
going
there's so
on.
many of them.
Yeah, that they have them with them, because, I mean, they can be useful, but they also, I mean, it's a machine and it tells you no shock deliverable. If it's so, it's, it doesn't, you need to know CPR along with having an AED.
You do,
Just
okay.
just because they go hand in hand. CPR works with an AED, and
And the AED's gonna shock the patient
if it's required.
if it's required.
Right,
Will it tell you yes or no?
yes, it
Okay.
will.
So it's a leadership
Yeah,
thing too.
yeah. But that's why we were saying, Stacy said it's easy to use. It's a product that basically tells you what to do. It tells you how to apply the pads, it tells you when to push the button.
Oh, it's wonderful.
So you don't have to be a medical person to know how to use it, or to even.
Even a medical person to do CPR, they say if you break a rib, you break a rib. Better to do compressions.
Right. But that's a good idea, I like that idea.
Very good
of
idea.
having-
So there's some back projects
Good.
that we're thinking of in the future,
I'm
so
very,
there's
very,
more
I'd
to
like
come
to
on
hear
that.
that. Thank you, Stacy.
Well, I
Thanks,
think
Kathy,
the more
about that.
the more you train people in CPR, the better chances, you know, because they say the faster, you know, health
Sooner.
is life. Yeah, the sooner you get flow, you know, and they're not focusing, nowadays, they're not focusing as much on the breathing because they've found that the chest compressions
Yes,
that.
because there's oxygen in the blood.
There's
and you just-
oxygen in the blood and it circulates it faster, you know. I mean, it's not that they don't do breathing, they do, but it's not the big focus as it used to be.
There's no sweeping of the mouth either anymore.
Oh, no, they haven't done that in years.
They want to make it as simple as possible
Right.
so that the novice or the bystander will get it.
Right.
If you make
Not
it
be
too
afraid.
yes, if you make it too complicated, people get nervous and don't
Of
want
course.
to.
Right.
They're afraid of hurting someone.
Right. The other thing is they're all afraid of possibly doing it wrong, but you really can't do CPR wrong. I mean, like you said, if you break a rib, yeah, that's something that patient can live with a broken
Yeah.
rib. If you get their heart started again, then the broken rib will heal. So we don't want people to be afraid to do CPR because they may break a rib, you know, or they may, you know. They're not intentionally trying to harm the person, they're trying to save them, so that's the important piece.
No, I mean, indoor sports, outdoor sports, you know, like I
Yeah.
said, you read all these things about these young kids.
Recently, it's
pavement
been very
and,
heavy in the news.
Yeah. Thank you, Stace.
You're welcome. Just one more thing.
Okay.
The state announced that we have our 5th case of West Nile virus.
Oh.
So not too bad. Last year was a little bit more, 7 or 8. We have to wait for that deep frost. So again,
Oh, right.
Yeah.
remind everybody that mosquitoes are still
Still
out
out
there.
there.
You're still out there on the fields and stuff, so make sure you have some protection.
And we have no update on COVID. We have no numbers because we're not responsible for that anymore, but COVID is around.
Right, because people are testing at home now, so the numbers
Right,
aren't
we wouldn't-
reported, so we
right.
don't have numbers to report on. It's more of a personal responsibility. If you're sick, stay home. If you have the kits, test, and that way you'll know to stay away from people or wear a mask. And
I'm
the
seeing more and more
guidelines-
people wear masks.
Yeah.
And you'll see the guidelines are on the nurse's report.
Yes.
They're
Right.
still there,
If
she
you-
puts them
right,
there all the
yeah.
time.
If you
And what
test
hap-
positive, you have to do quarantine for 5 days, and if symptom-free,
Mm-hmm.
you should wear,
So you'll
if
see
if
that.
you continue to have symptoms, you need to wear a mask for
Mhm.
5 more days, but other than that. So I think a lot of people are following those guidelines and testing
I
at
do see
home.
people with masks more so.
Yeah.
more
So if you're positive, you still isolate, but it's
Right.
just,
It's not quite as bad as it
not
was when it
not quite as
first-
bad. You're not getting a call from the health department putting you in it, ordering you in isolation or quarantine. It's
Right.
all personal responsibility.
Right.
Just like you would do if you had the flu or anything else, RSV or any other virus that you don't want to spread.
Yeah,
And then lastly, just wanted to let you know that the MHOA conference, Mass Health Officers Conference, is this week.
Oh,
Wednesday,
okay.
Thursday, and Friday, so many
Oh.
of us are going to it. So
Where is it?
It's
Cape
down
Cod?
Cape Cod, yeah, the same place it is all the
Are
time.
you staying over?
I'm staying over, Angelo's staying over, the assistant director Abby is not, Kyle is not, and then the rest of the staff is there.
Abby in charge.
Yes, Abby's in charge.
okay. All right, Carolyn, do you have anything?
No, I have asked enough questions.
I just want to make a note that the next meeting has been changed. The November 14th meeting has been canceled, and it's been changed to December 11th at 10:30. And you'll
We're
let
not
us
sure of
know
the
whether
place.
it'll be
Yeah.
here, possibly. Okay. I don't have anything. You've answered all my questions today. Want to make a motion to adjourn? A second, all in favor?
Aye.
We are adjourned.
Thank you.
Thank you.